Good morning. I am Scott Hara with UMHS, and today we're speaking with UMHS graduate Dr. Alexander Khobeir. And Dr. Khobeir, welcome today. And could you tell me a little bit about where you're currently working?
So I'm a second-year emergency medicine resident at McLaren Oakland Hospital in downtown Pontiac.
Okay. And could you tell us a little bit why you decided to attend UMHS? I understand that you and your brother both transferred from different med schools and that you graduated from UMHS while your brother is currently a present student at UMHS, correct?
Yeah. So my story is quite tumultuous.
Okay.
I endured the Hurricane Maria while I was a medical student in another university at the time. We went through the cruise ship, and unfortunately, the resources that I needed to get to where I'm at today, I could not be provided with. And I've only heard great things about UMHS prior to even thinking about transferring. I know that the family is Michigan based, and that is actually at the time where I had my interview and talked with many staff at the time.
Okay, and I understand that you have a really great working relationship with Corie Thayer in admissions. Can you tell us a little bit about what that experience was like with Corie?
Absolutely. It was actually Corie was the first person I met in here in Michigan. They had an office in one of the cities near where I lived, and I ended up going to an interview. And I remember Corie at the time was not in the position she is now, and she introduced herself. She was super nice. We were very calming. I went there for an interview at the time, and I had so many questions. I had never transferred in my life, and it was a great experience. I think overall I had no problems whatsoever. Any questions that I had, anyone and everyone would answer, and I usually got more than one answer, and they were really consistent, and I was really happy with that. They put Corie especially put me in touch with different alumni, different current students that I could talk to when I was transferring, but my mind was pretty set on transferring here at the time because of the great Ross family relationship that I had heard of, and the former school being a Ross school as well.
Okay, and can you tell us about one or two things that you think about UMH that really helped you become the doctor that you are today?
I cannot thank the fifth semester enough. I transferred into the main fifth semester, and it was really the fifth semester that did two things. It gave me the clinical knowledge, and it gave me the ability to talk with the doctors where I'm at now. It allowed me to have the sense of ease that I could do this once I was in the real hospital setting. And the other part was, of course, passing my boards. At the time, I needed to take step one, as everyone does, and UMHS provided me with the opportunity to take a course during the fifth semester main. That, including Dr. Thibodeau, who's the program director in fifth semester main, was great. That allowed me to do everything I needed to be where I'm at now.
Okay, awesome. And what would you say to, I understand that you're presently in an emergency medicine residency, correct? What would you
Yes.
say to a current or prospective UMHS student who's thinking about, not only going to UMHS, but also going into emergency medicine? I mean, what's some advice you would give them?
One of two things. Either way, it's going to hopefully end up with the same thing. First, come have a conversation with me. I have no problem. I will give you my phone number. We can talk. We can Zoom. We can meet in person when I have time off. But any specialty that you're going to, not just specifically emergency medicine, the road is long, and so for any prospective student, you need to understand that, and it's okay. It's going to be hard. Make sure you have a good support system. make sure that you are able to get that support system at any time. If you need to get in contact with them, you can always call me uh, for support. And the second part is emergency medicine alone. There's a big difference in the acuity, I would say. It is fun for sure. It's very exciting, but at the same time, you have to be able to think on your feet. And it's not all the time, but when you do, you have to be quick about it because it's a person's life. It is very rewarding. That's something that I tell students all the time. Emergency medicine is not for everyone, and that's okay. And at the same time, you are going to learn a lot, and that's in any area of medicine, but especially emergency medicine. You're going to learn to work through a lot, right? Because you are balancing more than one patient at one time. You are managing higher acuity patients, and you never know what's going to happen. You don't know what's going to walk in through that door. So be really mindful about what you want to go into and think about your own strengths. You have to sit down and really have that inner conversation with yourself about what can I do and what can I not do. And it's hard in the beginning because you don't know. So make sure you do your rotation emergency medicine, have conversations with people, and at the end of the day, just have fun.
Okay, great. And is there anything else that you'd like to say just in general to current or prospective UMHS students out there?
That again, I think that the most important thing is be realistic with yourself, have a good support system, and know that this is not a sprint. This is a long, long journey. Don't don't burn yourself out. Have fun along the way. The end is going to be there no matter what you do. So relax a little bit. It's going to be hard, but take it one step at a time, and I promise you'll get there.